My friend Johnny has been living with HIV for his whole entire life. Johnny was born with HIV and he was diagnosed with it when he was 9 months. The doctor said that Johnny wasn't going to be able to live a long time. At that time, medication wasn't really available for people, especially for infants, only for the rich people, people that were able to afford the medication. His mother refused to keep Johnny because of that. She said she didn't want to get close to her son and then he dies. They gave Johnny up for an adoption. Johnny is still living until today because of his adopted family. They fought every day for Johnny to get on medication and for Johnny to be well treated. Johnny appreciates his family a lot and loves them dearly, but Johnny always has to deal with that thought of him living with HIV. I remember I've spoken to Johnny and I've asked him, during the day, do you forget sometimes that you even have it? Johnny said, I forget, but as soon as I have to wake up and take that cocktail, it all comes back to me again.
HIV is a sexually transmitted disease that can also be spread by infected blood or other bodily fluids. HIV is transmitted during unsafe sex if your partner is infected, blood transfusions, sharing needles, and in some cases from mother to child during childbirth or breastfeeding. HIV stands for Human Immunodeficiency Virus. HIV infects and destroys your helper T cells. T cells are a part of your immune system that helps fight off pathogens such as infections or other diseases. The virus continuously replicates and is not stopped by your immune system's antibodies. Over time, your CD4 T cell count becomes so low that your immune system is pretty much gone. The average person has a T cell count between 500 and 1,000. HIV patients generally have a count of 350 or less. If your count falls below 200, you are considered to have full-blown AIDS. AIDS stands for Acquired Immunodeficiency Syndrome. AIDS is a life-threatening disease caused by HIV. AIDS shuts down your immune system to the point where any little sickness can kill you. Science believed HIV and AIDS first began in humans in 1908. HIV originally came from chimpanzees. A spillover event is when an infection or disease moves from one host species to another. Scientists hypothesize that the spillover happened when a hunter in the Congo in Africa was butchering an infected chimp. Chimpanzees are very genetically similar to humans, so the virus was able to survive in a human body. Over the next 8 decades, HIV continued to spread around the world. In 1981 was the first known case of AIDS in the United States, and since then it has become a national and worldwide epidemic.
According to AIDS.gov, gay, bisexual, and other men who have sex with men of all races and ethnicities remain the population most profoundly affected by HIV. The Center for Disease Control states that 63% of all new cases of HIV happen within the gay male community. The reason why this population is at risk is because unprotected anal intercourse is the easiest way for the virus to be transferred. In the homosexual community, African American men who have sex with men are the highest risk. Below men who have sex with men are the groups Black, heterosexual women, and men. A study by the CDC found that in the African American community, there are many factors that contribute to why the virus is so prevalent. First, this community has the greatest number of people living with HIV, and they tend to have relations with the same race. Second, a lot of people don't know they have it. The CDC states almost 85,000 HIV-affected people in the African American community in 2010 were unaware of their HIV status. Also, in the Black community, as in many other communities, there's a lot of prejudice and negative perceptions about HIV, so people just don't get tested because they fear rejection more than they fear the virus itself. Poverty also plays a big part. In the United States, poverty plays a big role because many people have limited access to high-quality health care. The lower your socioeconomic status, the more difficult it becomes to manage continuous care. Other issues related to poverty are access to good housing, education, and other factors that guard against risky behavior.
Living with HIV is a battle. At first, it is something that you don't think you're going to be able to deal with, but along the way, it becomes easier. It's not the death sentence it once was. The hardest thing was coming to terms with the fact that I have HIV, and when I found out I was diagnosed, my whole life kind of flipped around. It led to a uveitis, which affects my vision. I lost my vision for 6 months, so it can really trigger a lot of other things.
I extracted myself from everybody. I was in depression. I felt everybody was looking at me, everybody knew. I was just locked in my house. I didn't do much. I've got alienated from my friends, some friends. But mostly, yeah, the alienation of friends got even more depressed. They were all ignorant. Now, my future plans are to help people with the same condition now. So I want to go into that field also, to help other people as other people help me.
There's so many programs that are working now to bring in awareness to the communities that we didn't have some 20 years ago.
In the beginning, it seems like nothing's gonna ever get better, but in time, just give it time.
Just learn from all this. A lot is being done. In the future, who knows, there might be a cure.